I'll revert back to, my baseline, which is like, I eat red meat. I think it's fine to eat red meat. If you're eating red meat every day, you might want to rethink that. Because listen, a lot of people love a good steak or a good burger every once in a while. And you should, the point of doing all the stuff is so you can enjoy yourself. And if that's part of the joie de vivre, like, go for it. But I wouldn't do it every day.
Welcome back to another episode of the Peak Performance Life podcast. Today, I am very excited to have an expert on the line with us. His name is Dr. Vassily Eliopoulos, otherwise known as Dr. Voss, and he is a board-certified physician with extensive experience in emergency medicine and longevity science. He's a graduate of Cornell University Medical College with a background in neuroscience from Trinity College. And he spent over a decade in high-stakes emergency medicine before shifting his focus to proactive performance optimization. And his medical philosophy is deeply informed by his own pursuits as an elite athlete. He's actually a world master champion in Brazilian Jiu-Jitsu, a black belt, as well as a former state champion wrestler. So he understands firsthand the demands of high-level performance and the necessity of resilience. And he is the chief medical officer at Longevity Health, where he combines rigorous medical data with this athlete's mindset to create strategies that extend health span, optimize output, and protect you against injury. Dr. Voss, thank you so much for joining us here today.
Yeah, thanks for having me, Talor. It's a pleasure.
Yeah, absolutely, man. Really excited about this. I'm super into the biohacking longevity. I have a goal of me and my family all living to over 100 years old as a happy, healthy, thriving family. And so I love to geek out about this stuff, and I'm excited to jump into it. Why don't we start with like a little bit of a background? How did you get interested into the work that you're doing today?
Yeah, I think it was really a personal journey, because I have a familial high cholesterolemia where, pretty much all the males on my father's side of the family, he's of Greek descent, and all those men have cholesterol that's through the roof. If I'm not aggressively treated, my cholesterol will run easily in the 400 range.
Wow.
And so that was identified through me, actually through a middle school. Like, there was a screening thing that came through my middle school. And when they got the result, they told my parents, they're like, this is probably a mistake, but you should have it double checked. And then we identified all the males on my dad's side of the family basically suffer from the same thing. So I had gotten to a point where I had exhausted all of the traditional medical approaches and recommendations, and my cholesterol still wasn't really adequately under control. And so I had to leave the farm. I had to leave the farm of traditional medicine into this sort of space that a lot of traditional doctors are weary of. And I found solutions there that actually worked for me. And it was really the first time when, I started feeling better, I started looking better. And, ultimately in my professional journey, I got to a point where I wasn't really satisfied with my medical practice. I felt like emergency medicine can be incredibly rewarding. You help a lot of people, but I felt like it was a revolving door. I was just, you patch them up, you see them again. And I was like, I'm doing this for myself, like one thing for myself and something totally different for my patients. And that's really when I, decided to make the switch. And yeah, so that's really how it all started.
Amazing. Amazing. Yeah. I love hearing these stories of kind of traditional medical doctors that then make the switch into the kind of new, more longevity, sometimes holistic kind of things. Yeah. So, and right now, tell us about, you run, is it Longevity Health Clinic?
Yeah. Longevity Health. We're, sort of what we call like the family office for your health, where I think a lot of people are struggling to make sense of this space right now. And also how do you integrate this into your life in a way that's manageable? Supplements, peptides, medicines, like all the things, cold plunge, exercise, not all of us have all day, every day to dedicate to this. We got to find the most sort of time efficient way to do the most high impact things. And that's what we do. So we bring people in, we do a head to toe sort of executive style workup, and then from that craft a plan, and help people execute on that with like full nutritionist and physical therapy slash strength and mobility support, through their journey.
Amazing. Amazing. Yeah, I'm sure I want to get into what you kind of do in that full intake and some of the different tests and stuff that you do. Why don't we jump into that now? Yeah. So someone
Sure.
comes to you and they, where do you start?
Yeah, I think we have, I guess my approach is that, most of these executive head to toe physicals that happen, like Mayo Clinic's really well known, Cleveland Clinic, a lot of, Cornell where I went, a lot of these big university hospitals have these executive workups. And if you actually look at them, the workups are totally obsolete. I mean, completely, totally, utterly, they're using testing that's literally decades old, which is kind of shocking, but that's what it is. And so the workup that we do is all of the things that your listeners probably know about. We have sort of a baseline that we recommend, whole body 3 Tesla MRI, CCTA heart scan with AI analysis. We currently use Clearly because they're sort of scientifically validated to be the best analytic tool for that modality currently. We do, if there are any joint issues, this is, it's different than a lot of other sort of head to toe workups. Most places just forget about the musculoskeletal system, but that's a huge driver of morbidity, particularly as people age, pain in the low back, pain in the shoulders, pain in the knees, pain in the hips, and elsewhere, elbows, ankles. So if there's any sort of early sign of degeneration, we'll image that. And then all the lab testing, 100 plus, it's probably really more like 1,000 plus biomarkers, everything from gut microbiome, food sensitivity to traditional medical biomarkers, liquid cancer biopsy screening, microplastics, heavy metals, et cetera, et cetera, et cetera, et cetera. So it's really the most complete medical workup that I know of. And we've looked at a lot of, other people in this space. And then, of course, VO2 max, strength and mobility assessment, where we have a, really sort of, I think, best in class person who is a doctor of physical therapy, but has done strength and mobility for people for many decades with experience in like microneedling and cupping and all of the, the alternative modalities. He does an individual strength and mobility assessment. And then from that, we build, the plan, but it's a real, head to toe checkup, and everybody's a little different. So for example, if you have, I'm trying to think of some examples to make it clear. Like some people have, family history of autoimmune issues, right? Or I'm suffering with post-COVID symptoms. So, there is unique and individual testing that we can, tailor to your specific needs if there's an issue that needs to be looked at in a particular way. So that's also part of what we do. There's sort of the standard baseline testing that we recommend for pretty much everybody, and then there's the the unique situations.
Yeah, yeah, it's really interesting. A lot of the affluent people that I know that are not really into health, don't listen to health podcasts or really educate themselves on health. They all go to the Mayo Clinic or some, one of these big, because they say, "Oh, Mayo Clinic, that's well known. They must be the best, right?" So I'm going to go to the Mayo Clinic, and they have this 2-day or 3-day thing where you pay a ton of money. It's not cheap, and you go there, and I'm thinking to myself, is this, I've interviewed, a lot of people on this podcast who tell me a lot of the opposite things from what a lot of the traditional doctors at the Mayo Clinic would tell me. And so, I often wonder about that. And I think obviously it depends on who you're getting as a physician, I think, and who's interpreting that data is obviously a big part of it. But yeah, I'm always interested to see that. So yeah, I don't know if you have any insights on that as well.
Yeah, it's hard, right? Because here's how I would frame thinking around this point and other points like it. These institutions are fantastic at what they do. And what they do is they treat disease.
Mm.
That's what we do really well in the system. And that includes Mayo. If you have a bad diagnosis, run, don't walk. But if you're really looking for preventative, forward thinking, and what I would say is, traditional medicine has blind spots that it's not aware of. And we can kind of get into that. But if you're looking for a forward thinking, holistic approach to your health, in general, the system in our big institutions don't do that very well. They don't teach it. I mean, most of this stuff that I do in sort of the functional, regenerative, anti-aging medicine space, I did not learn in medical school or in residency or in like a whole career working in the hospitals. I had to leave that space to learn that stuff.
Yeah.
And so they just don't know it.
Yeah.
They're not familiar with the testing because they're used to doing the testing that payers cover, Medicare, Medicaid, insurers. And unfortunately, like we mentioned, a CCTA with clearly analysis, that's been an FDA approved diagnostic modality for, I don't even know, 5, 6, 7 years.
And what is that exactly for
Medicare,
people listening who may not be familiar with that?
yeah. So, yeah, great. Thanks for stopping me there. So this is a CAT scan that looks at the coronary arteries, so the arteries that supply blood to the heart, and it goes well beyond a lot of people might be familiar with the calcium score. The CCTA is a more in-depth CAT scan test, which even that isn't enough because the radiologist will read that and give you a report. But if you take those images and you load it into an AI diagnostic system, and that's what Clearly is. HeartFlow is another sort of their competitors in the same space. They've been evaluated and compared to cardiac catheterization and other objective measures of, plaque, measuring plaque buildup in the coronary arteries. And Clearly, based on the current literature, is really the best one. But what the Clearly bot does is it looks at those images and it will tell you in a quantitative fashion and qualitatively exactly how much plaque is in your coronary arteries, both soft, hard, and necrotic plaque. It will show you where that plaque is, and you can track that plaque reliably over time. So there's a dogma in traditional medicine that once plaque's there, it's there. I can tell you from clinical experience that's not true. You can eliminate plaque after it's built up. Mm-hmm. It's not easy to do, but it can be done, and you can track that on these scans. So that's what, CCTA is the CAT scan. A Clearly analysis is another test where you take that result and load it into Clearly system and get their analysis with the detailed plaque assessment.
That's really good. Yeah, really good info there. And I know we had a cardiologist on one episode, and he said that he actually goes with a mobile ultrasound. And it's the same thing, right? Because you get a traditional, your once a year, doctor blood test or whatever, your traditional blood test, and they just show you total cholesterol, HDL, LDL, right? They're not even looking at ApoB. Forget about doing any kind of scan to actually see if there's anything there, because like you said, you might have a super high cholesterol due to some genetic reason, but if your arteries and everything are looking great, you may not need to go on a statin, right?
Absolutely.
Yeah.
And a statin, I would argue, is sort of the knee-jerk reaction, and it's one of many different options, and the testing exists to really identify, like even if you're just looking at a traditional cholesterol panel, if you're doing what regular doctors do, and they just get a cholesterol panel and the LDL is high and they tell you should go on a statin, the reality is there's a whole host of medications and lifestyle interventions and supplements that can modify those numbers. And there's a deeper level of cholesterol metabolic testing that can be done that makes it very clear and will tell you, hey, you know what, this person's way more likely to respond to ezetimibe or bempedoic acid or Repatha or like any of the other number of cholesterol medication options. Any doctor can order these tests, but they're not used to doing it. Most of them don't even know they exist. They don't know how to interpret them and then how to, prescribe off of that. And so I think there's this, people are leery of going on statins. And in my opinion on that is the statin itself is a good drug for the people who really need it. And the problem is most doctors are just frankly being lazy and not doing the additional testing or the deeper dive that needs to be done to tell somebody whether it's really the actual right thing for them. And so people are then naturally, intuitively sensing this, even though they don't understand. They may not even know like that there's these other things that could be done, but they're feeling it. And they're like, wait, you're just telling me to go on this drug. And I've read about these side effects. And so, I think it would be way better for the system if they were a little more proactive in adopting this testing, and then they would be able to interpret and know how to prescribe and recommend based off of that. But anyway, sort of got deeper in the weeds than the question. But yeah, it sort of naturally flows, and that question often always comes up about statins after we have this conversation. So
yeah, absolutely. I'm actually curious, just as a side note here as well, how did you kind of get your hypocholesterol, can't even pronounce the word, the high cholesterol that you genetically had?
Yeah.
And I know also, like, for example, myself, when I started eating lower carb and replacing some of those carbs with healthier fats, you can oftentimes see an increase in your standard cholesterol numbers there.
Yeah.
Doesn't mean I necessarily need to go on a statin. I haven't personally done this scan. I would like to, but yeah, and I think my numbers are a little better now. But curious for people who maybe have gone on more of a lower carb diet, or someone who has a genetic situation like yourself, what are some things that you've done maybe to get it in check?
Well, that was a big one actually, because at the time, because this is now, we're talking, 15, 20 years ago, and it was fat was the enemy. And, I was rigorous about my diet, ate no fat, and it didn't matter. And in fact, often my cholesterol got worse.
Wow.
Because guess what? I'm eating more carbs.
Yeah.
And when I started approaching this from, sort of at that point in time, I had a colleague who I trained with who she suffered from lupus, and then sort of had the same journey for herself, but did it before me. And so I sought out her advice when I was like, I don't know who to trust in this space. I know Chris is good. So I went to her, and she's really traditional functional medicine, like diet, food is medicine, from that school. And she helped me with that. And that when I started, and it wasn't my cholesterol numbers at that point, because like genetically, I need medication. And so, almost no matter what I do, even though my numbers got better, they were nowhere near good enough. And yeah, but it was that shift into, fat's not the enemy. Healthy fat, your brain needs it, your body needs it. The problem is really processed food and the simple carbohydrates.
Yep.
And when I made that shift, I immediately felt better. Like I wouldn't say that I had a cognitive problem, but I noticed that I got sharper once I made that switch. And my inflammation numbers looked better. My cholesterol numbers looked a little bit better, but I need prescription medication. And so I'm on a statin, I'm on ezetimibe, and I'm on Repatha. And I need all of those to really keep it in an ideal place. But before that shift, it was like everything was topsy-turvy.
Yeah. Interesting stuff. So going back to kind of the full body scans and those kind of things that you do as well. Yeah. So let's actually touch on that one real quick. Full body scans. I know there's a lot of places that are popping up these days where people are doing full body scans. What is your opinion on them? Are there different ones that you do, different than what other people are typically doing? What should people look for if they're thinking about getting a full body scan?
Yeah, great question. I think here's what a lot of people go to their regular doctor and they ask like, hey, what's up with this Pronovo whole body MRI? And this is how I was trained. This is how these doctors are trained. And I'll give you a little context. What they're going to tell you is, man, you're going to find a bunch of fascinomas, like little things that don't really mean anything. Like listen, our bodies are all different. And some of us have a cyst in the liver, and some in the spleen, and some in the pancreas. And, that's normal. It's just going to make you worry, and it's going to make you have to do follow-up studies, and it's not worth it. That opinion, in my opinion, is jaded based on the fact that traditional doctors don't want to order the scan because they know insurance isn't going to cover it. So what it's going to do, it's going to unleash a torrent of paperwork that they're going to have to go back and forth with the insurer about for weeks. That's going to tie up their time, their staff's time. They don't want to deal with it. And then even if that gets approved, then they're going to have to fight for the follow-up scans, if any are needed. And so that's what a lot of people get from their doctors. Then it confuses them because they don't understand. The school of thought that is sort of, I think, coming into the forefront now is, listen, cancer is one of the big, it's one of the big problems in Western society. There are others above it, but it's a big one. And cancer, when found early, is relatively easy to deal with in most scenarios. So why wouldn't you, you're going to find out one way or another, right? You're going to find out one way or another, and hopefully it's not too late when you find out. It's way better to find out earlier. And this is where layering of diagnostics, we don't have one cancer test that can cover you for all cancers, right? Like an appropriate cancer screening regimen for any individual will be based on their age, their family history, so their personal risk, and then what their sort of personal preference for proactivity is. Because I typically recommend for 50-year-olds and above, annual screening with whole body MRI, liquid cancer biopsy screening, skin, at least once a year skin check, make sure over 50 colonoscopy, colon cancer screening is important. So you can't do a whole body MRI and not get your colonoscopy. And if you're a woman, you can't do a whole body MRI and not do your PAPs and your mammograms, et cetera. So I think that's an important point, is the whole body MRI doesn't replace everything else. But what it does is it gives you a look at many organs that we don't have another screening test for: kidney, liver, pancreas, spleen, musculoskeletal tumors, bone tumors. So whole body MRI can be an effective, screening tool if used appropriately. And I have 30-year-old, clients, members, patients who, I'm like, maybe every 3 to 5, depending. And they're of the mind and the financial, have the financial support to say, well, why wouldn't I do it every year? I'm like, well, if you want to do it every year, absolutely, right? Like, I don't know that it's necessary, and I'm not going to argue with you because, man, it's I'm trying to thread the needle for what's reasonable financially from a time perspective. You know what I mean? From all these perspectives, and how many 30-year-olds actually get diagnosed with it? Like, your risk is way lower. You know what I mean? But so whole body MRI is, in my opinion, a very useful tool when used with everything else. And then more specifically, to answer your question, ideally you want a 3 Tesla. So some of the older MRI machines are 1.5 Tesla. This is the strength of the magnet, because it's a magnetic resonance imaging. So they're using a magnet to polarize basically the water in your body. And the stronger the magnet for this type of testing, the better imaging quality you get. And not all whole body MRIs are the same. So a lot of places are selling a whole body MRI, and they're doing, chest, abdomen, pelvis. They're doing basically your torso area, but they're not doing the brain and neck, and they're not doing, the extremities. Some places do a whole body MRI and it's from the head down. Some places do a whole body MRI, and there's specific ways to image the biliary tract, meaning like the ducts that come out of the liver and the pancreas and go into the intestine. So there's a sort of a number of different ways to do it. And the only reason I'm bringing this up is not every whole body MRI is the same thing. And so this is where having somebody who understands this to help guide you can be really beneficial, because if your family history is such that, yeah, you really want to image that biliary tract closely, you want to make sure that your whole body MRI actually incorporates that into the scan that it's doing. And the same with, maybe you really don't need head and neck every year, right? Or some places are just doing chest, right? So just know that there is nuance to what people call, whole body MRI. There's some nuance there.
Yeah, yeah, that's really good to know. I do have to admit, in the beginning, I was a little, afraid of like, oh, everyone's gonna find something and all that kind of stuff. But one doctor gave me a good piece of advice, I thought, which is, he's like, look, at least do it once and get your baseline
Yeah.
so that you can see in the future, right? And it's interesting because I actually know someone who did a full body scan, and the doctor who reviewed it or whatever, they said, yeah, everything's fine, no problem, whatever. And then I think 3-4 years later, they did it again. And then it was like, oh, there is something in your brain, something, I don't know if it's like an aneurysm or a tumor or something. I don't know exactly what it was,
Yeah.
but it was like, oh, it's in your brain. And, and then she had to have follow-ups with specialists. And they're like, yeah, to be on the safe side, you should probably get brain surgery basically and take it out and all this kind of stuff. And then it's like, well, was it there on the first scan that we did? And they go back and it's like, yeah, it was there. Did it grow at all? No, it hasn't grown in 3-4 years. So now, I mean, look, it's a very confusing situation,
Yeah.
and they don't really know what to do. But it's, if she didn't, if they didn't have that first scan,
Yeah.
then you wouldn't even know when you did this follow-up one, if something. So there's a lot of nuances there, but I think it is interesting to get that baseline so that you can see, is this actually growing or is it staying the same for 5-10 years? And is it growing as something I need to really, really jump on?
Yeah. Yeah. It's a great point. And I think this also just sort of sheds a light on, traditional medicine, what it does. I think just people need to reframe their thinking around traditional medicine. We call it healthcare. Now your listenership is familiar with, the sick care model, but, health is what happens to you up until the point that you need the healthcare system. And healthcare is what happens to you after that to take care of the problem. And that's what healthcare is good at. But this is another, like, screening, proactive. This is really, in my mind, in the future, it will probably have two different systems, meaning once you have disease or a problem, the reactive care, which is necessary and important, and then a proactive system, which is a totally different sort of training and testing system, because this same philosophy is important for your metabolic markers, like especially your hormones.
Yeah. Tell me more about hormones. Yeah.
Yeah, well, and particularly for women. I mean, men are a little bit simpler from a physiologically, biologically there, but even still, I mean, I would love to have known, like, man, even just my total testosterone, like, what was it, in my late teens, what was it in my 20s, what was it in my 30s, even just having a few snapshots, and particularly for women at different points in their cycle. I mean, because your estrogen, when perimenopause happens, man, it would be so nice to just know, man, when you're in your prime, your peak, when you were in your 20s, like, what did your cycle look like on, data wise? What were the estrogen levels? What were the progesterone levels? What were the, free and total testosterones? Because then, and it's not that, oh, it's right to like do therapy back to that, because you're physiologically a different person, but it's just like having that context is so helpful in the few people where you even happen to have, oh man, they actually did check my testosterone for whatever reason back when I was 32. It's just so useful to see that. So that, another thing to think about, it's worthwhile getting a good panel, once a decade, even if everything's going great.
Yeah. Yeah. And it's a good point that you made as well. I think women at different times of the month could have very different
Yeah.
blood panels.
And that's totally normal and expected. And then when things start, when we hit andropause and menopause, which everybody's going to hit, you have a bit of a roadmap.
Yep.
which really nobody has at this point because medicine doesn't do proactive testing.
Yeah. Yeah. That makes a lot of sense. Yeah. If someone in their 20s was never higher than a 800 testosterone, at least they know that when they're in their 50s,
Yep.
60s, they're not trying
Yep.
to hit 1,000, 1,100.
Yeah.
They don't care. They know,
Yeah.
hey, if I get back to 7, 800, I'm back to where I was. Yeah. Yeah.
Yeah. Yeah.
Yeah. That's interesting. What other tests do you think are really important that not a lot of other people are doing?
Yeah. Good question. I think it depends on how old you are. I think, up until your 30s, getting like a great place and really currently the most financially economical place to get a panel like that is really through Function Health,
Hmm.
because you can get the panel that they're doing for, I think it's like $500, which, for a lot of people, it's a significant chunk of money, but the number of labs and the breadth that you get, you're not going to get it cheaper anywhere else.
Yeah.
Um, and I think, I don't know, they either have a great deal with their lab, whoever's doing their labs, or they're subsidizing a bit to try to drive membership. I don't know. But either way, like, if you're young, healthy, 20, 30, that's probably the right place to start. When you start getting older, when things, start to maybe, not work quite as well as they used to, you can take it as on an as needed basis, meaning, gut microbiome is a thing that a lot of people struggle with. There aren't actually many people who are really good at helping you interpret and deal with the results. So, that's just, eyes open when you go into that. You want to find somebody who has experience like looking at that, because my perfect microbiome could be totally different than your perfect microbiome. And
Mm.
that's it's like a unique fingerprint. And so, that's another one that, as I'm saying it, maybe that's a worthwhile one to do in your 20s, just to see like, what does my healthy, great microbiome look like when my gut's functioning, really, really well. Then food sensitivities is another good one. The problem there is that most labs just do an IgG test, and you're going to, like, a lot of people will just ping positive for a million things. What you want to do is you want a lab that will go that next step, which is not just see if you're making an IgG antibody, but see which of those IgG antibodies is actually triggering inflammation, because it's a next level of testing, which can really narrow down, okay, what foods do I really need to be careful with, and what foods are just, am I eating? Because a lot of people, if they have any leaky gut, and guess what, in the United States almost everybody has some leaky gut, and some people worse than others, we're all generating IgG antibodies to foods that we eat. And the question is, do I really need to eliminate all these things? And if you're just doing an IgG test, you're not getting that information. You need to go that next level deeper. So KBMO is a lab that does that. There are some other labs that do that. Trying to think, I think the most impactful testing addresses the biggest problems, and the biggest problems that we have are cardiovascular disease.
Yeah.
And so the testing that we started off talking about, CCTA heart scan with clearly analysis, cholesterol metabolism testing, apolipoproteins and inflammatory testing, those are probably some of the highest yield, because that's what most of us are going to suffer from later in life.
Mm. Yeah. Yeah. And you mentioned some people who had maybe plaque in their arteries were able to reverse that.
Yeah.
How were they able to reverse that? Was it through diet, lifestyle?
Yeah, there's a lot of different ways. So, Esselstyn, Ornish have a protocol. So those are two of the doctors. If you ever watched Forks Over Knives, the documentary, which is really promoting sort of a vegan diet, there's two doctors that they look at there, who are sort of pioneers in the nutrition space, and they have a 12-week protocol, which is dietary. It's free. You can, look it up online. Ask ChatGPT. It'll give you all the details. But basically, that protocol, what it does is it goes on a very strict no fat diet,
Hmm.
because what it's doing is it's starving your body for fat.
Hmm.
Because what is soft plaque? Soft plaque is just fat that's built up in the arteries. Now, this isn't something you want to do year round. This is a very strict short-term thing, but by starving your body for fat, your body is going to start scrounging for fat everywhere it can, including your plaque. And that's one of the ways that you can get pretty significant soft plaque regression by just basically forcing your body to scavenge the plaque for the fat that it needs for its metabolic purposes. And again, it's not healthy to do over the long term, but for an 8, 10, 12-week intensive protocol, depending on, what you're trying to do, that can be very effective at resorbing plaque.
Yeah.
IV phosphatidylcholine infusions, so plaque X infusions, so is sort of the brand name or the trade name. Now those studies are done in animals, but regular IV phosphatidylcholine infusions in animal studies have been shown pretty clearly to help resorb plaque. Another thing that can do that, believe it or not, is Repatha, which is the PCSK9 inhibitors.
Is that what Repatha is, one of those PCSK9 inhibitors?
Yes.
And that's different than a statin, right? Because I had a
very
friend,
different.
Yeah, I have a friend who said,
different.
"Oh yeah, I don't do statin. I take the PCSK9 inhibitor,
Yeah.
which I think is just an injection every once in a while."
Yeah, a lot of people call it a peptide. It's a monoclonal antibody, so it is a protein, but and all like peptides are proteins, but it's a specific type of protein. It's an antibody, and it's an antibody that interrupts the way the liver metabolizes the LDL receptors, and it allows your body to just suck more LDL out of the bloodstream and process it out of the system. So that whole class of medication, that's what it does. It's a twice monthly or once monthly injection, depending on the dose. And, it's got a very good side effect profile, meaning every medication is going to have side effects. Some people, some people could have a life-threatening anaphylactic reaction to something that 99% of the other people do fine with. So you have to know, there's no drug that's perfect, but it's a highly effective medication with a very good side effect profile. And a lot of people love it because it's so effective. And in the studies that they've done, almost half the people who don't change anything else, but just, they're supposed to be watching their diet. So assuming they're doing the right things with their diet, by just adding Repatha, half the people start resorbing plaque.
Wow.
Yeah.
So,
and that's not, that's scientifically validated. These are the large placebo-controlled studies that are done looking at these drugs.
Sounds more effective than a statin, with potentially less side effects, right? I wonder why more people aren't talking about this over statins.
It's because they're still on patent. So up until very recently, a month's worth could cost you over $1,000. They've been around now. They're not new. They've been around for almost a decade. They've been around for 6-7 years. I can't remember exactly. You could look up the date, but we're in a few years, we're going to hit a decade soon, and prices are starting to come down, and insurers are starting to cover it. So if you have insurance through work, and you have high cholesterol, it's getting easier to actually access. I have a lot of members in my practice now who their insurance is covering it for $50 or $75 copay a month. They're able to get it covered. So it's really it was a price hurdle.
So it's a patent. The company had a patent on it. The patent only lasts for, is it 10 years?
It depends. If they do if they do everything they can to preserve the patent and file all the extensions, et cetera, which pretty much everybody is going to do, it's almost 20. If I'm remembering correctly, it's almost 20 years on patent.
Got it. And then when it comes off a patent, then everyone can just do generic versions and the price goes way down. But until then, they're kind of controlling the price here. But insurance companies are starting to realize it's so effective that even at the higher price, it's probably worth.
We're going to save on the cardiac catheterizations, which are one of the biggest, expenses probably that they're, so it's nice to see that they're maybe they're forward looking, or maybe they're just getting a better deal in negotiating. I don't know, but that's sort of why they haven't been in the public consciousness and they're going to, like, they will, I don't want to say replace statins, but in my experience, both as a patient using it and as a doctor prescribing it, they work way better than statins. Way,
Mm-hmm.
way better.
Yeah, yeah. I want to get into a little bit here as well, how you eat and your philosophy on food, nutrition, maybe some exercise stuff.
Yeah.
And I know, because you just mentioned, like, oh, for people who maybe have cardiovascular problems, they do the vegan diet. Now that's going to be usually a lot higher carb if you're pulling out the fats, right? So maybe you get less cholesterol maybe comes down, maybe inflammation goes up if you're not doing it the right way.
Yeah.
I've had some people argue the inflammation is really the problem with heart disease more than the cholesterol, right? So
Yeah.
you start getting into that battle. I know personally, I'm very concerned about brain health, and I don't want to have, dementia like my father
Yeah.
currently has. And so, there are some healthy fats that seem to be,
Yeah.
for me, going on a low carb, kind of like, I would say moderate to high protein, moderate to high, I guess moderate fat or so, whatever it is,
Yeah.
with healthy fats is kind of what I find works well for me. My inflammation is very low. I feel great. I used to have tons of pain and inflammation in my body about 15 years ago when I was
Yeah.
much higher carb and didn't follow this type of thing. But that may also raise my cholesterol being on this diet, right? So there's all these things
Yeah.
that trying to do this balancing act.
Yeah, you're threading the needle the same way everybody else is. And so here's my perspective, which is there really shouldn't be any confusion around nutrition, because the information, the literature, the diagnostic testing, the genetic testing, it's very easy to look at, a metabolic panel like the one I mentioned earlier that you get through Function Health or a practice like mine, or that metabolic panel plus your family history can give most people what they need to know how aggressive they need to be about a particular section or sector. Like, is it cholesterol and lipoproteins? Is it inflammation? Is it blood sugar? Is it antibody production? So there's sort of like a couple of different ways to chunk up or categorize all the biomarkers. But what I would say is that if you have the ability to do the testing, the genetic testing, the food sensitivity, the gut microbiome, the imaging we talked about earlier, somebody like me can tell you very specifically exactly what your ideal diet is. And the ideal diet for one person could be very different than the ideal diet for another, which is what makes it hard. And so I think the best single resource that the person I look up to on nutrition is Walter Longo.
Mm-hmm.
Now, he's more of a proponent of a plant-based.
Yeah, we had him on the podcast actually not too long ago.
Yeah, he's brilliant. But what he'll say is, eat at the table of your ancestors. I don't know if he, said that, to you, but I think that's a great place to start. Is look at what your family did 2 or 3 generations back is probably, the right sort of nutrition plan for you. But then getting more like detailed, I think the problem we have is that our system is saturated with processed foods, particularly carbohydrates. And most people are eating way too many simple processed carbs.
Yep.
And if people spent less time worrying about, red meat and fat and more time worrying about carbohydrates and processed foods, we'd be better off as a culture, as a society in general. The problem comes that a lot of people will go keto or close, go really low carb. And it's a little bit of like license to eat a lot of like bacon and red meat,
Right.
and it tastes good and I like it, but if you're not managing your biomarker, you can do that if your cardiovascular biomarkers are managed. This is the key that a lot of people skip, because you can shift to that, low carb, higher fat, good tasting things. And so the keto, there's a study where they actually looked at people who went keto and looked at, it's the keto CCTA study, where they actually looked using CCTA and clearly at what was plaque formation in these people. And if you're not managing your biomarkers, the plaque buildup can be terrible. And
Mm.
in fact, in that particular study, the results showed that if you go pure keto and you're not careful in the high risk cardiovascular foods, you are likely laying down plaque at the level of a type 2 diabetic
Mm.
at a similar rate, which is
Mm.
shocking because people feel good, their triglycerides drop, they get muscle definition, they have mental clarity. And so by all outward measures, it looks and feels healthy. But when you actually, if you're not, you have to manage your cardiovascular risk. So that's the one sort of thing I would say we have to be careful of with a higher protein, you know, meat, fat, fat heavier diet. Make sure you're managing your cardiovascular risk, because if you don't, you're going to pay for it later.
Yeah, yeah. I think I guess what a lot of people call dirty keto, where people are eating just like tons of bacon and cheese and stuff like that.
Totally.
Yeah, that'll probably definitely do, not be real good for you. I think like for me, I eat red meat maybe a couple times a week. Typically, I'll have salmon or some sort of fish a couple times a week, maybe chicken a couple times a week, and then eggs I eat every day. Love eggs, so that's a
Yeah.
you could argue that's a high fat, but also kind of high protein,
Yeah.
low carb, food. I feel amazing on it, right? I am aware of like trying to supplement with some more fiber, since I may not be getting enough fiber if I'm very low carb, in many cases. So yeah, it's a never ending balancing act.
No, yeah, I like what you're saying. I mean, I eat eggs. I love eggs. I like red meat. Um, the longevity data is pretty clear that when we eat red meat, we're activating mTOR, and that is not good for longevity when done on a regular basis. So that said, does it mean you can't eat red meat? No, of course you can eat red meat. Um, you just have to. So the way I would think about it is, you want to balance that with something that's going to shut mTOR off. And so for me, what I do with my patients is typically, my patients are fasting at least twice a year, meaning 3-day
Mm.
either fasting mimicking diet or water only diet, anywhere between 3 and 5 days, depending on what their, how experienced a faster they are. That's going to shut down mTOR. It's going to drop your IGF-1. It's very good for longevity. 2 a year is probably enough for most people. And so the final thing I'll say on nutrition is, what's the point of all this anyway? Is because we want to live a life that we enjoy.
Yeah.
And nutrition, for many of us, is just part of enjoying life. And so your plan has to allow space for you to not feel like, any sort of plan that feels really restrictive is not good for your long-term health.
Yeah. Yeah,
You could think of
the
that
red
as,
meat one is an interesting one. We've heard a lot of different opinions about it. Some people say, "Hey, red meat is actually the most nutrient dense food." I'm also
well, it is.
suspicious of. I'm also suspicious of like when they do these, let's say, tests or studies on people that eat meat. Are they doing, are these people going and getting a Happy Meal from McDonald's where they're eating bread and French fries and soda with the meat,
Yeah,
with this low quality meat? Or are they
totally.
eating, grass fed beef with avocado and lettuce? And are those being factored into the equation? I'm not sure that I've ever seen a study where they're
Yeah.
like, yeah, we're studying people who ate meat, but also were low carb, ate lots of vegetables, ate super healthy. I don't know that they've done a study on that specifically. So there's definitely a lot of nuances,
Yeah.
I think.
I think, so I guess, I'll revert back to, my baseline, which is like, I eat red meat. I think it's fine to eat red meat. If you're eating red meat every day, you might want to rethink that.
Yeah.
Because listen, a lot of people love a good steak or a good burger every once in a while. And you should, the point of doing all the stuff is so you can enjoy yourself.
Yeah.
And if that's part of the joie de vivre, like, go for it. But I wouldn't do it every day.
Good insights. That's fair.
Yeah.
Definitely.
Yeah.
Dr. Voss, this has been awesome. Where can people follow you, find you, learn more? I know you have this concierge program.
Yeah.
It's not a low cost thing for people who are just who only have a few $100 to spend. This is more of a real concierge. You're going deep. You're doing things that practically no one that I know of is doing, this kind of full intensive stuff that you're doing. But would love to hear a little bit more about where people can get in touch with you.
Yeah. Thank you. Yeah. The clinic website is longevityhealth.clinic. And really the best place is, Instagram at at Vassily, Dr. Vassily. So it's at Dr. Vassily, and, follow me there and I try to put out information that's useful for everybody. Talk a lot about, everything we've talked about is stuff that you could go through my Instagram and get a ton of valuable information around all these topics.
Amazing. So at Dr. Vassily on Instagram, and then it's longevityhealth.clinic, not .com, longevityhealth.clinic as the website. Dr. Voss, this has been amazing. Really enjoyed the conversation. I hope we can do it again sometime.
Yeah, would love to. Thanks, Talor. Appreciate it.
Thank you. Thank you for listening. If you enjoyed this episode, it would really mean a lot to me if you would forward this episode along to any friends, family members, anyone that you think that would get value out of it and learn something important. The mission at Peak Performance is to help people prioritize and transform their health. And so if you think someone will get value, please, please, please do forward this episode along to them. Also, if you could please rate and review and subscribe on whatever podcast player you are listening to this on, we would greatly appreciate that as well. It means a lot. And I want to tell you about a couple of new products that we just released. You can get 20% off your first order at buypeakperformance.com. That's BUY peakperformance.com. We just released a brand new grass-fed beef protein isolate. This is my favorite new protein powder because it's great for muscle building and recovering and all that kind of stuff, but it doesn't give the stomach discomfort and gas that a lot of people get from different types of proteins like whey protein. Some types of plant proteins can do the same as well. It seems to be really, really easy on the stomach while still giving all the great benefits of muscle building and everything else that you want from taking in adequate protein. So check out our new beef protein isolate. We have it in unflavored, which I actually mix and blend with my morning coffee every morning. We have a vanilla and we have a chocolate. You can buy it on Amazon, but again, you also do get 20% off your first order at buypeakperformance.com, BUY peakperformance.com. We've also recently released organic mushroom coffee. We have these in Keurig compatible K-cup coffee pods. We have organic mushroom coffee with lion's mane, reishi, cordyceps, turkey tail, and chaga mushrooms blended with the high altitude organic coffee that we've been using and that we've been famous for years. So that's been a big hit, that one as well. You can get on our website or Amazon, any of our products. And of course, we're always famous for our organic green superfood powder that has almost 5,000 reviews on Amazon with a very high star rating. We're known as the best tasting USDA certified organic green superfood powder with over 25 plus organic ingredients. Again, we also have the organic red superfood powder. We still, of course, have the organic plant protein for those who do prefer the plant protein, but I'm really excited about this new beef protein isolate and all of our other products. We do have over 100 products, so just check us out if you type in Peak Performance Supplements on Amazon or if you go to buypeakperformance.com. Thank you so much, and we'll talk to you again soon.